So we are from Legacy on Main, which our main office is in Batavia. Tina's actually in that picture somewhere. But we have agents out here in Central New York. We have Rochester, Finger Lakes, and we have Western New York too. So basically what we do is mostly Medicare stuff. But we also do, some of us do life insurance, some of us do under 65 insurance. Here's most of our people. And then there's Tina. So Tina lives in Baldwinsville, right around the corner. And basically what we do is we help people understand Medicare. ABCD is what we're going to do today. And then also, you know, help them figure out what their best option is based on their health needs and that sort of thing. So I'm just going to go over to my kind of itinerary here, or my agenda. So I wanted to start out talking about the different parts of Medicare, some different options that are available to you, Medicare supplements, Medicare Advantage plans, prescriptions, what if you're still working, that sort of thing. Sorry, wrong one. Sorry. Okay. This is, it's a Medicare Advantage, it's called a Clarity Guide. It happens to be through United Healthcare, but it's nothing plan specific. It's strictly understanding Medicare, and I just like their publication, which is why I'm using this one, okay? So, different parts of Medicare. Original Medicare consists of two parts, Part A and Part B. Part A is your hospital, inpatient, skilled nursing, hospice, and blood products, okay? Typically, there's no cost for that for most people because when you're working and you're paying into it, this is what you're paying, okay? Part B is your outpatient medical tests, procedures, emergency, that sort of thing. And for most people, that has a cost of $164.90 currently. It can depend on your income, however. If you have lower income, you could have an opportunity to have that part paid for you. If you have higher income, you could have an additional amount added to it, okay? So if you're a single person, more than $97,000 a year, 2 years ago, they look back 2 years, then you could have a higher adjustment called an IRMA adjustment, Income Related Medicare something adjustment. Or if you are a joint filer over $194,000, you could also have an increase in anything above that as well. But for most people, it's $164.90. When you first turn 65, you're going to want to at least pick up Part A. Part B is going to be somewhat dependent on whether you have other coverage, if you're still working, if you have a spouse who covers you. So Part B is optional. But if you don't pick it up when you first become eligible and don't have other coverage in place, other creditable coverage, then you will have a penalty when you do pick it up, okay? Same applies to Part D, which is your prescriptions.
Now, is there a one-time?
What, the penalty?
Or is it an ongoing?
It's an ongoing penalty based on how long you went without creditable coverage. Yep. So, you know, and when you become eligible for Medicare, you want to look at your own situation and determine, do I need Part B? If I'm not going to pick it up, do I have something else that's going to take the place of it as creditable coverage? And FYI, veterans' health benefits do not count as creditable coverage for Part B. Okay. Sometimes people go to the VA, you know, and when they turn 65, they only pick up their Part A. They don't pick up their Part B, but Part B is not creditable coverage, it doesn't count. Because the veterans' benefits are a benefit, not insurance, okay?
So workplace, if you're still working in with workplace insurance, you don't get penalized.
Correct. That's right. Yep, so you can defer that, okay? If you just had this Medicare A and B, original Medicare, you have deductibles, you have co-insurances, 20%. Medicare pays 80, you pay 20%. So that can get really costly. This part doesn't include your prescriptions. You have to pick that up separately, and similarly, there's a penalty if you don't, okay? So typically, what we're going to do is we're going to help people with a couple of different options that they can add to their original Medicare to get all the coverage that they need and also help to keep their costs down a little bit, okay? So one option, a Medicare supplement plan or a Medigap. So that is a separate piece of insurance that is sold by private carriers, and it works alongside of your original Medicare to help cover some of those out-of-pocket costs. The Medigap is going to cost you a monthly premium in addition to that $164.90. Currently, it's between $200 and $300 a month, okay? But the reason that some people go this option is because, like I said, it helps to cover some of those 20% co-insurances that you have. If you have a lot of out-of-pocket medical expenses that are costly, like chemo, infusions, dialysis, that sort of thing, this might be a good option for you. It's more about covering those out-of-pocket expenses than it is about making sure that you have all the bells and whistles at this point, okay? If you're in a situation like that. So you pick up your Medicare supplement plan and your Part D separately. It doesn't give you any dental, vision, hearing, any of those extra benefits, okay? The other option is a Medicare Advantage plan or a Part C. And the way those work are they roll in all of your A and B benefits and then give you more stuff, okay? So you're getting a big, complete package. It includes all your A benefits, your hospital benefits, all your medical benefits on B, gives you your prescriptions, dental, vision, hearing, fitness, over-the-counter benefit, and it gives you low to no monthly premium, and then you just pay co-pays, okay? So if you go to the doctor a couple times a year, even if you go to the hospital and have a procedure, you're just paying co-pays and not a monthly premium typically. Some of them do have a small monthly premium, but there's plenty out there that don't.
So that's a Part D.
Part C, which is the Medicare Advantage, and it combines it with your Part D prescriptions. So you get it all in one.
So Part C is the one that encompasses
Correct.
all of them.
Yeah, it's the complete benefit package, and it's usually a lower cost, okay? But like I said, if you have the medical need with those certain, types of things, then option one could be a better fit. Now, in New York State, we don't have underwriting on our Medicare supplements, so you can go from one to the other, okay? If maybe now option two is a good fit, but down the road option one makes more sense, we can make a change, okay? Any questions on that?
Is that a certain period of time?
Yep.
When you make the change, that's that enrollment period?
Right.
Okay.
Right. So when you first turn 65, you're in your initial enrollment period, and that can happen at any time, okay? You've got a 3-month window before, a 3-month window after, and the month that you were born. So you have a 7-month window that you can enroll in Medicare, make your choices and so on. But then subsequent years, you have a couple different options. October 15th through December 7th is our annual enrollment period for a January 1st effective date. So that's when everybody takes a look at the new plans for next year and they decide if they want to make any changes or if they're good where they are, and they can make their choice for next year. January, February, and March is open enrollment, and they kind of have a second chance. If maybe they decided that the choice they made wasn't the best one, they can go back and make a different choice. Hi.
Oh.
Come on in.
Okay, thank you. I want to see something.
But all year long, we have what's called special enrollment periods. During that time, there may be different opportunities for you to make a change, such as moving, retiring, qualifying for extra help. A low-income subsidy gives you an opportunity to make a change. EPIC, New York State Pharmaceutical Program, also gives you an opportunity to make a change. And frequently we have FEMA or disaster type of special enrollment periods. Right now we have gun violence, we have a flooding disaster, we have, usually an opportunity. So there are opportunities throughout the year to make changes outside of these annual enrollment and open enrollment. And we just take it on a case-by-case basis. If you're in May and something changes with your health or your needs, we review that and we take a look and see if we have an opportunity to make a change if necessary. Okay? So we don't make you pick, one and you're stuck there. Okay. This is just kind of some statistics that we need to jump into. Prescription drug coverage phases are important to understand. If you've ever heard of the donut hole or the coverage gap, basically the way this works is if you are on prescriptions or on a carrier that has a deductible in place, it typically would be somewhere between $150, $300 type of a deductible. And most likely it's just for your higher tier prescriptions. Rarely do we see it on the tier 1 and 2 generics. So you have to meet that first. And then you'll have your co-pays. It might be anywhere from $0 to $50, depending on the tier, it would be a little higher. So you're paying your co-pays, and kind of what's going on behind the scenes is the total cost of your medication is counting towards this total drug cost right here at $46.60. So for example, you might be on a medication that costs $1,000, but you don't know it costs $1,000 because you're paying your $25 copay. The insurance company is paying the other part of it. And that's what's being totaled up towards this $46.60. So when you reach that threshold, you might go into what's called the donut hole or the coverage gap. So one day you go to the pharmacy, your medication is $25, the next month you go and they want $250. And they tell you that you're in the coverage gap. So now what you're doing is you're paying 25% of your drug costs, and the insurance company is paying less than they had before. If you come out of this phase by reaching this amount in your out-of-pocket costs, then you'll go into the catastrophic coverage where your costs are going to be much lower, maybe $2 to $4, okay? A lot of times people don't come back out of it for the year. It starts over every year. So they're just paying that higher cost. If you are a member of New York State Epic, that can help you to curb some of those costs. So New York State Epic is a program that, as long as you are 65 or over, single up to 75,000, married up to 100,000 threshold. The EPIC program will help with the cost of your medications, especially in that donut hole, okay? If you qualify for EPIC, there's two different sort of plans that they offer. Fee plan members actually pay a premium. That's for people with lower income, which seems kind of backwards. If I have lower income, why do I have to pay a premium? But what happens is you pay a small premium and the program helps you immediately, okay? Whereas the deductible plan members have to meet a deductible before the plan is going to help them, okay? So there's a chart based on, if you're single or married. This is the fee schedule. So if you, let's say you make $20,000 a year as an individual, you're going to pay $230, but you get the benefits right away. And the benefits being no more than $20 for any drug, even in the coverage gap.
Can you like, let's say I decide not to be a part of that EPIC the first few years, but then decide like the third or fourth year because of illness or whatever, I can join the
Yes, absolutely, anytime. Maybe it's something that's not going to help you right now because you're on one generic medication. But then in the future things change, yeah, and you might need this. Here's the deductible schedule. Okay, so if you have deductible to meet, this isn't anything additional over and above. This is just when you're going to the pharmacy, you make sure the pharmacy has your EPIC on file. And every time you pick up a prescription, they're giving you credit towards that deductible. And then once you meet it, then now it's helping you, okay? So it can be kind of high, depending on your income.
So while you're trying to meet the deductible, does the cost you're paying for the prescription?
Just your copay.
$5, $10, $20, that's what adds towards the deductible, or
Yes.
is that tier two?
It's the copay that you're actually paying in the pharmacy that goes towards the deductible. So I mean, this can look kind of high, but you know, I have an individual that I'm working with, and his medications are about $800 a month, his cost. So he could likely meet this deductible in a couple of months. Okay. It's kind of hard to see on the screen, but, oh, there it cleared up. They all have their tier, you know, different carriers have different formularies, but they're generally the same. There might be a couple of different variations. There are pharmacy networks associated with your prescription drug plan, whether it is a standalone plan alongside a Medigap, or it's combined into your Medicare Advantage plan. So some pharmacies may cost more because they're standard versus preferred. The carriers have a mail order option as well. Some drugs are subject to certain things like step therapy. The carrier wants you to try maybe this generic first before they'll approve your specialty drug, something like that. Quantity limits on certain drugs. Some of them aren't eligible for a 90-day supply because of the drug. Some of them require prior authorization. There is the opportunity to ask for an exception, either a tier exception, maybe to have it tiered down, or a formulary exception if it's not on the list at all, to request that it's covered. And they do get right on those requests, because sometimes it's, you know, a matter of you have to have this medication. You know, you can't be waiting around for it to go through all the red tape, so they do get right on these. Okay. I'm going to jump back over here. I did mention briefly the Medicare Savings Program, or low-income subsidy, or extra help. This is an application for individuals that fall within a certain income eligibility that can not only help them pay that Part B, the $164.90, but it could also give them eligibility for something called a dual plan, which is a Medicare-Medicaid type of a plan. They work together where Medicare pays part of the cost, Medicaid pays the other part, and there's no cost to the beneficiary. So currently, an individual making $22.80 per month or less could qualify. Couples making $30.77 or less could qualify, and at that very top limit, that would be just the Part B being paid for. It wouldn't give you that dual eligibility, but these other two, well, they're the same. That would give you the eligibility possibly for a dual plan, okay? These are,
And it's your, what you make like through 401ks and pensions and things like that, everything,
Right.
including your social security.
not assets, but income, yes. So if you're taking like a monthly draw out of your IRA or something, that would be considered,
Okay.
but not your assets. If you're doing a full-blown Medicaid application, they're looking at your assets.
Right.
But if you're just doing a Medicare Savings Program application, they don't look at that, okay? Let's see. So we talked a little bit about that option, which is a Medicare supplement plan. So I'm just going to show you this information. The Medicare supplement plans are Plan G, Plan N, Plan L, and so on. And the plan and what it covers is exactly the same among all of the carriers. Okay, this happens to be AARP, which is United Healthcare. Humana's is the same, Aetna's is the same. The only difference is the cost, but they all cover the same thing. So basically with this one, Plan G, which is the one that we normally go to, the only thing that's not covered is your Part B deductible, which is currently $226. Everything other than that is covered. No out-of-pocket expenses. But again, you're paying a $200 to $300 a month premium, okay? But if it's necessary, then it is necessary.
And I see that, because I travel, I like to travel. I also see that it's the G part is covered, looks like travel is covered 80%.
Yes, on your Medicare Advantage plans, they all have foreign travel emergency coverage at zero.
Oh, really?
Yeah.
I didn't know that.
And on the Medicare supplement plans, you have an 80% coverage. Yep.
Okay.
Let's see, what do we need to cover? So the way that we, as an agency, determine what's the best fit for you, first of all, we're looking at Medicare Advantage versus Medicare Supplement and what's the most, what makes the most sense for you currently. But then what we do is we look at your prescriptions and we take into consideration what medications you take because you're going to get those on a monthly basis. You may or may not go to the doctor or have a surgery or something, but you're getting your medications, so that's always where we start it. Oops, sorry, I clicked on the wrong thing. I didn't have it open. We put it into basically Medicare.gov, which is a public-facing website, and what that helps us to do is determine what is the most cost-effective plan based on your medications. Then we're going to help you look at benefits included, co-pays, the carrier as a whole, what we know about it, their network, making sure your doctors are going to take it and that sort of thing. Okay? So that's how we help people figure out what is the best option for them. Now, if you are still employed when you turn 65, like I said, you do have the option of turning down your Part B. Does it make sense? If you're paying $400 a month for your plan and you have a $2,500 deductible, on paper, the numbers, Medicare is a better fit. But it also comes back to your company, and it's a conversation you want to have in your HR department. Is there going to be any repercussion if I go to Medicare and come off of this work plan? If you're a retiree and you're on a benefit from your former employer, most times if you go off of it, they won't allow you to come back on it. Okay, it might not be the same if you're still an active employee, but if you're a retiree, a lot of times that's the case. So we can help you understand that. We can help apply for Medicare. You're going to want to do that probably about 3 months before you turn 65. Unless you're collecting Social Security retirement benefits already, they will automatically send it to you. But if not, you're going to want to apply for that. If you are collecting Social Security benefits, they will take your Part B premium right out of that before you ever even see it. If you're not, then they're going to bill you 3 months in advance. So that can be kind of, tough to swallow when you first get that first bill. If you do defer Part B, you still want to pick up Part A, adding Part B is just a couple of forms. It's very simple, okay? And that can be done at any time, and we just have to prove that you had creditable coverage. We did have another over here. So if you are still working, there's different things to consider if you're still working. If you have Medicare due to having end-stage renal disease or disability, different things that you might want to consider. How it works with other coverage. If you have like a group plan and your Medicare, who pays first. If you're covered under workers' comp, if you're covered under the VA, TRICARE for Life, these are veterans programs. So these are things that we would go over on a case-by-case basis with people, help you understand, what's the best fit for you. Are you still working?
Yes.
Yep. Okay.
Do I plan on? I plan on leaving next year.
When you turn 65?
Well, I think probably around September. I turned 65 in July, so I was thinking maybe, the end of August, beginning of September.
Okay.
Leaving. So, I also was going to call my HR and see if I could, if I could keep my medical insurance and pay what I'm paying now through, but I don't know if they're going to do that. If I could carry it with me.
Depends depending on the cost, if it
Yeah.
makes sense to do that.
Yeah.
I will tell you, based on your timing, you're turning 65 in July, but you may stay working until September and maybe not need to pick up Part B until October. September. They may roll it all the way back to July because it's still within that initial enrollment window.
Oh, really?
Yes, I ran into that with somebody, so just, you know, when the time comes, either have Tina walk you through that or have somebody help you out with that, because you don't wanna wind up having to go back and pay for it anyway.
Right, right.
Yeah, it's about the timing.
Yeah,
So.
yeah. I really, yeah, I know that, that's why it's like.
Yep. Questions about anything, whether I went over it or didn't?
Well, I'm still kind of confused between Medigap
Okay.
and what is, my understanding is that once you decide not to pick up Medigap, you can't go back and.
In New York State, because we don't have any underwriting, they will let you go onto a Medigap plan, even if you're older, even if you have a condition, as long as you didn't have any lapse in coverage of more than 63 days. Okay? Other states, that's not the case, because there is underwriting, and they're gonna say, oh, well, now you're older, so you have to pay more. Or now you have cancer, so we're gonna deny you. But in New York State, if you decide that you want to go on a Medicare Advantage plan because it makes sense now, but later you get a diagnosis that changes that decision, we can change you, okay? So you come off the Medicare Advantage plan, which does include your prescriptions, and you would go on a Medicare supplement plan with a separate prescription plan, okay? If it's something that is a temporary condition, it's resolved, you're treated, you can go back over onto the Medicare Advantage plan. The only thing we need is an election period, okay? So if it's outside of one of the built-in election periods, we might need EPIC. Maybe you qualify for LIS or, you know, low-income subsidy, that'll give you an opportunity. So it's just, you know, you just need that to be able to change one way or the other, okay? But what it does, the Medicare supplement, let's say you're up here on original Medicare, you have a $1,600 deductible on Part A, your Medicare supplement's gonna pay that, okay? You pay your $226 deductible on Part B, then you go and have a surgery, or you go in the hospital, your supplement's gonna pay that, okay? So you're paying up front, whereas on the other option, you're paying as you use it, okay?
And Part C, which encompasses all of them. And you said something about vision, hearing,
Yes.
dental?
Yes.
Now the dental, you have to go to certain dentists that take Medicare.
Usually, yes. There's a couple of carriers that have, it's called an open network. You can go to any provider, you're gonna pay, and then you submit for reimbursement. Most of them have the network though, and we had this conversation at the last place we were at, the network is not great. Some dentists don't take insurance at all, or some don't take Medicare insurance. So sometimes it can be tough to find a network dentist. But most of the plans and most of the carriers either have a PPO, which means that you do have out-of-network coverage. So you might not get the full benefit, but at least you'll get some with that dentist. Or something they started doing this year is an HMO POS, which is kind of a hybrid. It gives you just out-of-network on the dental, not the rest of your plan, just the dental. Because I think they recognize that the dental network is just so difficult, okay? So HMO being strictly in-network, PPO being in and out, HMO POS kind of a hybrid, okay? So this is what we help you figure out,
Yeah,
okay?
yeah, because I see like commercials on TV for, dental, just dental insurance and stuff. And I wasn't sure if that was going to be part of, if you need to do that separately in order to get dental insurance that way too.
Right. Some of the carriers, some of the plans have just preventative dental included. there may be a rider that you can pick up through that company that gives you the comprehensive, or you can always add a standalone dental plan. You know, there's a lot of different ones out there. Just depends on if they have a waiting period or, you know, this, that, or the other thing. But depending on your needs, can help you find the best option. But they do include at least preventative in all of these Medicare Advantage plans.
Oh, they do?
Yes. Eyewear benefit. It's gotten very competitive. All the carriers are adding more and more stuff, so you'll pick them. So fitness membership, silver sneakers, whatever they call it, silver and fit. A lot of times there's an over-the-counter benefit, which would be like your supplements, personal care items, first aid supplies. They give you a certain amount of money to spend quarterly. Okay? So Tina and I, as brokers, we broker for most of these carriers. Not all of them, but we do handle most of the national and local carriers. So we can help you find one that offers what you need it to, and we get compensated the same. So there's no incentive for us to, you know, say one over the other.
So you get compensated through the insurance company?
Correct.
Okay, I
You don't pay us
like
anything.
Okay.
Nope, absolutely not.
Yeah.
My slides back in the beginning, I just added, where am I here? I just added what is a broker? We work for you, not the carrier, you know, so that's what we're here for. It's about education, knowing your options, understanding. The other thing that we do is we're here after the fact, okay? So if you have questions, what the conversation we had at the last place, a lot of the carriers are outsourcing their customer service. You can't understand them and they can't understand you, okay? So that's where we come in. Because if we can't answer the question, we know who to call to find out, okay? We have a little bit of leniency as your agent of record where we can do things on your behalf, okay? The carriers let us change your address, you know, add a dental plan, something like that. Of course, you're gonna tell us to do that, but you're not the one that has to call, we are, okay? So that's kind of what we do. Any other questions? You guys are easy.
We don't know what
So
we're doing.
the travel insurance now, or coverage, is that also abroad or just in national, you know, within the United States?
The Medicare, original Medicare, A and B, that only gives you coverage in the United States.
Okay.
When you add a Medicare Advantage plan, or the supplement, you know, with its 80%, then you have worldwide emergency coverage. Yeah, but again, it's just emergency coverage, okay?
Right, in case I'm skiing in Switzerland or something.
Right,
like,
and then if you need to follow up, you gotta get back here, because that's not covered. But a lot of carriers have a nationwide network within the United States, so you could be in another state and still have the same coverage, doctors in network as you would right here, okay?
That's
So,
good to know.
yeah, if you travel, you know, we're gonna look at plans that give you that kind of benefit.
Right.
Yeah. This is me back in Genesee County, but I have agents from here to Niagara Falls. Okay. Well, that's all I have for you. I hope that helps make things a little clearer.
Yeah, a little bit, yeah.
Okay, well, we have some resources. I have those Epic applications. I have this, what I was going through, I have over there. Tina has some cards if you wanted her to follow up with you, or she has business cards.
Yeah.
Yeah, any resources you would like to take, and then, you know, obviously you can get in touch with Tina.
So you, how many insurance companies do you deal with? I mean, all of them, like, well, United Healthcare, Excellus, I'm assuming.
Yes, in this area, United Healthcare, Excellus, which is your Blue Cross option out here. Humana, Aetna, You don't have WellCare, but I do. I also have Highmark Blue Cross Blue Shield out my way. So there's just a couple of them that we chose not to participate with, but we have those.
Okay. No, and that's fine, I just,
Mm-hmm.
because there's some of them I don't care for.
Yeah, a lot of people have their, their
Yeah,
favorites or the ones they dislike. Did I forget anything, Tina?
I don't think so.
Okay. Well, thank you.
Thank you.
Appreciate the